Okay, I think we're going to get started. So, good afternoon, everybody. My name is Simon Bukel. I am the Chief Marketing Officer for the Children's Tumor Foundation. Welcome to this webinar. Welcome also to Awareness Month. We are still early May, and as you know, May is NF Awareness Month. And also, as you know, we are in a very interesting time with everything that's going on with COVID. So we have a very special guest who will be introduced in a minute, talking about stress and NF during this time of COVID. Before we get started with that presentation, just a few notes with some house rules. First of all, this webinar is being recorded, so just so you're aware of that. Everyone is already on mute, but if you happen to be unmuted, please go back to being muted if you're not speaking, so that we keep the sound levels clear. After this, because we're recording this talk, we will post it on our website and on social media. And if you have trouble finding those, you can always find all our links at ctf.org. From today forward. The recording itself will probably take a couple days to go up. We, as you can see, this presentation is being closed captioned at the bottom of the screen. And then we'll also just verify the captioning and then post it correctly captioned. You can submit questions through the chat function within Zoom. You should see that button at the bottom, or you'll have the opportunity. There's also a way to raise your hand, and you can click that button and we'll certainly call on you at some point. But the chat function is certainly the easiest way to go. And with that, let's just get right into it. I'd like to introduce Pam Knight, who heads up our clinical programs here at the Foundation, and she'll take it from here. Go ahead, Pam.
Okay, thanks. Hi, everybody. Glad you could join us. Before I introduce Dr. Lester, I want to just give you a little bit of background on the program. So the excuse me, NF Resiliency program that we're going to present today is based on work by Dr. Anna Maria Verchanu, who is an expert in behavioral health interventions and clinical trials. Dr. Verchanu is very well connected with the NF community. You may have seen her talk about this work at NF forums sponsored by CTF and other forums around the country. Since 2013, Dr. Verchanu has received CTF research funding totaling $450,000 that allowed her to conduct the first pilot clinical trials of this approach with international patients. And she tested it on various groups: adults, adolescents, adults who are deaf, and also caregivers. And the point is to improve quality of life and psychosocial functioning. Many of these, as a side note, participants learned about these studies through the NF registry, which is nfregistry.org. Side note, if you haven't received these notices, the last one was in April, please log into your registry account and make sure that the email address you provided is up to date. And if you need any help with that, you can always contact us by email at nfregistry@ctf.org. So this online Skype-based approach that you're going to learn about today overcomes barriers to care experienced by many NF patients, such as the need to travel long distances for clinic visits and also the time and cost of travel. So obviously, it's really great that they have developed this already, because it's more important than ever to be able to deliver care this way during the current pandemic. So today, presenting the program is Dr. Ethan Lester. He is a clinical psychologist and a researcher in the Integrated Brain Health Clinical and Research Program, which is in the Department of Psychiatry at Massachusetts General Hospital and Harvard Medical School. He is a current lead clinician on the NF Resiliency program, and he's mentored by Dr. Verchanu. He has specialized training in behavioral medicine and behavioral therapies with special expertise in working with people who are adjusting to chronic health conditions. He provides psychosocial care to patients and families, and notes that his work has been enriched by his experiences interacting with the highly resilient NF community. Dr. Lester receives funding support from NF Northeast, NF Midwest, and the Texas Neurofibromatosis Foundation to extend the web-based resiliency program for adult patients all across the globe who are looking for ways to improve their stress and quality of life. Dr. Lester?
Mm. Thank you so much, Pamela. And hello, everybody from Boston, Massachusetts. I'm currently visiting with you from my home, as I imagine most of us are spending our time these days, not just on Zoom, but also confined to the walls of our living space. It's interesting how work and life and children and everything has now shifted so much. We're spending much more time in places where we might not have before. So today's presentation that I've prepared for everyone is really talking about just that. It's about adjusting to the stress that's inherent to your environment changing, to the world around you changing, to new fears and concerns and uncertainties. And so what I'm going to do is I'm going to go ahead and share my screen here and start this presentation. And just to get a good sense, everybody can see my screen before I start. Perfect. So what I want to start today really, first of all, again, thank you so much for the introduction. I work with a pretty specialized group at Massachusetts General Hospital. It's the Integrated Brain Health Clinical and Research Program, founded and directed by, as Pam said, Dr. Branchanu. So I joined this group back in 2018 as their first intern in their clinical program, and have stayed on as a postdoctoral clinical fellow in psychology. And so starting today, first of all, I want to say special thanks, first of all, to CTF and you know, allowing them to have the host of this webinar, and then also the financial funding I get from NF Midwest, NF Northeast, and Texas Neurofibromatosis Foundation. They've been instrumental in providing me some of the support and resources to be able to adapt this program that I'll be talking a little bit about later on in our presentation to an online web-based platform. So just making sure I can move along my slides here. So our agenda for today is actually pretty simple. I'm not here to really teach you a whole bunch of new things about coping or NF. It's really to remind you of how challenging this time has been and how it takes a lot of intention and a lot of purpose to integrate new strategies and skills for managing this stress. Because if we're not paying attention to it, it may just catch up to us and overwhelm us in a way that we least expect. So coping with this uncertainty and managing this stress is also what we'll be talking about today. And then at the end, I'll introduce a couple of our programs that we have currently going right now, and I'll provide much more information on those as we get there. So let's take a quick moment to, again, recognize where we're at. Like dominoes falling, it seems that before you knew it, we found out about this new virus, this virus that came to America that maybe we weren't prepared for it to do so, and here it is. And people started wearing masks, and we started to really realize what it meant to be 6 feet apart from one another. No more hugs, no more handshakes. I remember pretty early on hearing a news reporter say, there's a neat way that you can say hi to people. Hit them with your elbow. Well, not hit them, but shake their elbow. We're not even doing that anymore. You know, this changed a lot of things. It created a lot of fear. There's a lot of uncertainty. People are now graduating online and parks are closed. Children are bored and parents are stressed. We're working from home. Work has invaded our home. We are now no longer working from home, but we're managing a crisis while also having to work in our own homes. All the while this is happening, people are sick and they're dying, and we're experiencing a catastrophic global grief that we've never felt before as a society. And it raises so many concerns and so many questions, and all of a sudden we're met with this big exclamation point, this, oh my gosh, this is our world. This is where we're living now. And I don't need to remind you that living with a chronic medical illness is difficult, but doing it during a pandemic is even harder, because all of these things that you're so used to, meeting with your doctors, procedures, have been postponed. A medical illness that's already isolating, that makes people feel less than and different and distant from others. We're now even farther apart for reasons of this virus. We're feeling stressed, and we have tons of questions about whether there's comorbidities and co-occurring issues that make COVID-19 more possible or less possible. And we have all these questions and concerns, all the while not having enough answers on the web or from our doctors or our friends. No amount of assurance could make us feel better about what all this insecurity and unknown means. And so what are we doing? We're eating more sugar. We're eating more than we should, perhaps. We're spending more time late on our phones and not getting enough sleep. We're not getting enough exercise. And like I said, coping with NF is hard, but coping with NF during a global pandemic is even harder. And so as a psychologist, my main interest is how do I make people's lives better? And not only how do I make these lives better, but how do I study this in a way that would generalize, that would make other people's lives better long-term and carry us through this time. And so being aware of our own well-being and our mental health, there's small things that we can do that can make really big differences in our daily lives. First, and maybe I don't need to be the first to remind you, but first it's important to remember that we're all human and we have basic needs. We have these basic self-care strategies that if we disengage from and don't pay enough attention to, things start getting worse a lot quicker. Eating well, nourishing your body, sleeping enough, exercising regularly. It may be really hard to do that right now when you're confined to your home or to your neighborhood, or you're not able to go to the grocery store and feel safe, but there are ways to get out there. There are ways to increase your exercise, to eat well and to sleep well. And again, it's basic, but it's also important to be communicating with others and to share about your feelings, that we're all going through this together and this is a scary time. And you can depend on people right now, even if it doesn't feel like you have it as bad as other people. We're all going through this together, and it's important for us to share and talk with one another. It's also important to remember that there's this fundamental strategy at play, that a lot of times we're presented with this overwhelming difficulty, and it's hard to parse out what we need to spend time trying to change versus spending time accepting so that we can make other changes. Often these problems that we're presented with during a time of high stress require a mixture of both acceptance and change. For example, I may not be able to change the fact that I'm not able to go to work right now, or that I have to put my procedures on hold, or I'm not able to get out in the world the way I want to. And that doesn't actually prevent me from still doing some of the things that I really care about. That both of those strategies are true. Being able to accept things, all the while changing the things that you can, is a way of approaching this in a way that will help you through this time. And then very basic and very simple, finding ways of just appreciating and getting that source of inspiration and gratitude for what you think and what you feel and the things that you do have. We're learning a lot about what we need right now, and we may not be getting everything we need, but there's many things in this world right now. I mean, for example, I look outside right now and the sun is shining, and in Boston, sometimes at the start of May, we may still be getting snowstorms. You can never really tell. And so just having good weather is something to be grateful for. Having enough food, having patience, having a loved one who's going through this with you. This one's very important. Again, as a psychologist, I'm interested in helping people's lives get better. I'm also interested in people's behavior. And when people set goals and when people are trying to do things to make their lives better, but they don't reach those goals, that can be really disappointing and discouraging. So during this time, more than ever, it's important to set achievable goals, goals that you can feel satisfied with when they're over. Because a goal is really a way of reinforcing yourself. It's that moment you're looking at your checklist and saying, I did it, that's good, we've done it. But if you're not making goals that are achievable and sustainable and that are improving your life, you may just be making yourself feel worse. So finding ways of setting those achievable goals is a very important strategy during this time. This one goes without saying. I believe most of the people I speak with in my weekly groups for our NF resiliency trial are talking with their doctors pretty regularly. Some people are going in for their visits, and that is up to you and up to your choice, of course. But if you're not able to meet with your doctors in the same ways that you're used to, continue to follow up virtually. There's Patient Gateway and telehealth, and these resources, though they're not perfect, they're what we have right now. And it's what we may need to do in the meantime to get through this hard time. Many people are foregoing visits and communicating with their doctors because they're in a state of crisis and a state of constant change. But we're trying to find this new normal, and maybe part of this new normal is finding new ways to speak with your doctors. And then last, this one may be the most basic, but reduce your risk, follow CDC guidelines, take patience with yourself as you know that these are big changes, wearing a mask as you go outside, physical distancing, washing your hands excessively, what may feel excessively, but it's important to follow these guidelines because they're what keep us safe. And so these are basic skills. They're not anything that I would expect to totally rock your world or change your worldview on how all this is going. But when we review and we think about how basic it is to actually make your life a little bit better during this time, that in itself can facilitate different ways of thinking, different ways of feeling, different ways of behaving that can overall reduce your stress and improve your quality of life. So I want to practice a couple skills together. I didn't come here just to talk at you. So I hope as people are joining this group and are willing to practice with me, I'll introduce a couple tools that we use in our groups and that I've used for quite a while with both my patients and participants in our clinical trial. So it's almost this ancient wisdom that maybe mom or dad or grandma or maybe your teacher in first grade taught you, like me. Just breathe. Literally breathing is what your body needs. And so what we're going to do right now is we're going to do what's called the diaphragmatic breathing process, also known as slow breathing or belly breathing. And so the way this works, I don't think I need to explain how to breathe to people in this group, but air comes in through your nose and out through your nose or your mouth. There's no rules. But what I want you to do is think about as you're breathing out, almost in this three-dimensional breath. That as you breathe in, your shoulders don't need to go up, your chest doesn't necessarily need to go up. I want you to think about your belly expanding. And I'm going to give us a count. So if you're willing to, you can close your eyes during this process. You can leave them open and just paying attention to the words that I'm saying. I'd like for you to do on your next in-breath, breathing in for 4, breathe in, 2, 3, 4, out, 2, 3, 4, and 5. Breathe in, 2, 3, 4, out, 2, 3, 4, and 5. Breathe in, 2, 3, 4. One more, 5, and out, 2, 3, 4, 5, and 6. Breathe in, 2, 3, 4, and 5. Breathe out, 2, 3, 4, 5, and 6. One more time, 2, 3, 4, 5, and 6. Breathe out, 2, 3, you guessed it, 5, 6, and 7. So when we're doing this diaphragmatic breathing, we're intentionally engaging a muscle that was meant to help us breathe. That is actually impossible to hyperventilate when you're breathing from this part of your body. That you're training this muscle to actually be able to take in the air that it needs, use it, and expend it. Now you might have noticed I changed a little bit of the counting. I always like to have a little bit longer of an out breath to really clear out the lungs as you're breathing. Breathing in a little bit shorter, breathing out a little bit longer. And you can increase that. You know, you don't need to challenge yourself. You don't need to be gasping for air at the end of your out breath. But you'll also notice that as you stop paying attention to how scared and worried and concerned or upset and angry you are, and you start focusing on something as simple as your breath, or something as simple as the counting of your breath, you can actually find a little bit of space, a little bit of lightness. And eventually you're no longer thinking about how upset you are, but you're thinking about how you can nourish yourself with something as simple as breathing. So that's diaphragmatic breathing. That's one skill that for a lot of people in a moment of crisis or stress will keep them from panicking and will help them feel a little bit more connected to the world around them and to their body. The other skill I wanted to mention today, and it's really more of a philosophy and perhaps even, you know, a greater conversation. It's something I'm very passionate about and that the field of psychology has moved towards pretty radically, I think, in the past 20 years. We find that with behavior change, to actually make lasting changes, we first of all need to be aware of what's happening, of our patterns of behavior, of our ways of thinking and feeling. But to do that in a way that's judgmental or only half invested, won't give you the same kind of change potential as if you were engaging it in a mindful way. And so when I speak about mindfulness, what I'm really referring to is a present moment awareness. It's this way of paying attention on purpose to whatever is happening right now, whether it be happiness, sadness, anger, car noises, car alarms, dog barking. You're paying attention on purpose and withholding judgment, not saying this is good or this is bad, or this is yes, or this is no, I want more, I want less, but really just saying, whatever it is, it's here, and I'm here to pay attention to it. There's many ways to practice mindfulness. One way, of course, is mindfulness meditation. I won't have us do a formal meditation today for the sake of time. What I want us to do right now is a tool that I learned from my mentor in graduate school, who is a child psychologist. And I think that in many ways, kids understand mindfulness in some ways better than adults do. And so for the sake of this time, I'd like for us to close our eyes, again, if you're willing, and practicing the skill of mindfulness, connecting with that breath. It doesn't need to be diaphragmatic. Just noticing where your breath becomes your breath. Is it at the tip of your nose, the back of your throat, in your lungs or chest? Is it hard to find your breath? Just take another moment with your breath. And I'd like for you to keep your eyes closed, but in this moment, shift your attention to the sounds around you. Perhaps you could take a moment right now to listen for the smallest sound you can hear in the room. And if you have earbuds in, you can take them out for a few moments and just give the room a good listen. See if you can pay attention to the smallest sound you hear for the next few moments. You may have found that there's a sound that you didn't realize was joining you in the room today. Perhaps it's the sound of your air conditioner, or if you're living in a condo in the middle of Boston like myself, maybe a loud noise outside that draws your attention, but the smallest sound is one that requires more attention. And for some people who are practicing mindfulness on a daily basis and create a practice out of this, some of them hear their own heartbeats in their ear. You have blood vessels by your ear. Some people can hear that. And for those people who may not be able to hear as well, or who have difficulties hearing as part of their NF diagnosis, the same present moment attention can be brought to something as simple as your hands. So let's take a moment again to use that same present moment focus. Just take a moment to study your hands. Noticing the lines and the contours. Maybe you notice the swirls and crescents and waves of your fingerprints. It's been a while since I've looked at those. Maybe you take a step back and look at your hands and say, wow, what amazing things these hands do. They hold things and they feed me and they create. How wonderful my hands are. Taking another moment, just looking at your hands. And when you're ready, just coming back to this space again and knowing that mindfulness really isn't about breathing or listening or looking or seeing. It's about experiencing. It's about being present with whatever's happening in the moment. And sometimes the moment can be really hard to tolerate, and that's okay. Giving it space to open up and blossom and let go is just one of the many ways you can handle stress. One of the many ways you can live more fully and more intentionally. And so there's skills that you practice, and of course there's ways of approaching the world. And for the sake of questions, I want to just take a moment to, first of all, thank you so much for joining this webinar today. It's nowhere near over yet, but I just wanted to take a moment to really thank you for taking the time to invest in yourself and to learn a little bit about how you can cope during this time. And hopefully that you'll go on and share a couple of these very simple but very necessary skills that I've introduced today and that maybe you've heard already, but that you're willing to practice for yourself. Self-care, gratitude, acceptance, mindfulness, breathing, setting goals that you can achieve, and keeping up with your doctors and following good medical and health advice. So I'm going to take a few moments now to answer some questions. I'll select questions which are broad and related to my expertise. And so with that being said, questions can come in either the chat form or in the raised hand fashion. I'm a little new to this function on Zoom, so you'll have to be a little patient with me. So please take a moment or two to type out some questions. A couple disclaimers that I won't be able to answer all questions, of course, and I'm not able to answer any medical or biomedical questions related to COVID-19. In part, well, in full, really, this is not my training. I'm a psychologist, I'm not a medical doctor. And then, of course, my views are my own and don't necessarily reflect the views of Mass General or Harvard Medical School. So I'd like to end the show here and maybe take a few moments to answer some questions if anybody has some.
So Ethan, we have one in the chat room, and I think you talked about this a little bit. So while we're waiting for other folks, and again, if people would like to ask questions, just type them into the chat function or press the little hand, and we'll see that you raised your hand if you want to actually talk. If you want to talk, you can type that into the function too. Just ask us to unmute you, and we'll be happy to do that. Dr. Lesser's been very kind and said he'll take live questions. We've got the one question here, which I think you touched on a little bit. How can teenagers prepare for surgery during COVID-19 for when non-essential surgeries are back available again in New York in particular, and probably other locations too? So.
Yeah, I think this is a wonderful question because it communicates a couple things to me. I think one, this is somebody, maybe either a concerned parent or even a teenager themselves, who is looking for ways to use this time right now really valuably to prepare themselves for what's to come. Non-essential surgeries are still difficult surgeries, and they may not be held in the same medical arenas as someone who's urgently requiring surgery, but a surgery is a surgery. And for a teenager, or really for anybody, it can be very, very scary. So a little bit of preparation, I think, goes a long way. I think this mental practice of just really hoping for the best case scenario, always, investing a little bit of time each day and imagining how the surgery could benefit you, how you trust your medical team, how, you know, that right now it's on hold, but it's eventual and it will happen. And when it does, you would have taken the time to really prepare yourself mentally for it. I think some of the skills related to stress and stress management can be really helpful. I think another skill that we really miss out on a lot is this positive self-talk. Our natural tendency is to just go with the worst case scenario always, because it's what's kept us alive. It's, if we can imagine, you know, if we step off a curb that we may get hit by a car, well, it's better to be thinking the danger so that we're not going to step off that curb. But our natural tendency is to think in some negative ways. And so actually changing the way you're thinking, maybe by using mindfulness skills, you can actually, I mean, truly, you can actually change the way you're thinking so that you're not feeling so overwhelmed by the possibility of things that could go wrong, or you know, what the future holds and the uncertainty of it all. Give yourself a moment to feel how big it is and remind yourself that right now you're safe and whatever's to come will come.
Okay, we've got a shy audience today. It doesn't look like we've got any questions. We'll give another 5 or 10 seconds, but otherwise I guess you could probably continue. So.
Yeah, I think timing wise too, I think I'll keep of course going with a little bit of the presentation, but as people either work up the courage or, you know, have questions, maybe when I introduce a couple of our research agendas and studies, I'd be happy to answer those, and I'll refer back to the chat or live questions as they come up. So I'm going to continue sharing my screen. I'm actually really, I'm surprised with how smoothly this is going. I know CTF does these all the time, but this is my first webinar over Zoom, and I'm just feeling very grateful for the possibility of this going actually quite well. So, so getting back to a little bit of our work that we do at Mass General. The first one is our adult Department of Defense funded resiliency study. And so this is really for adults 18 and older who have a diagnosis of NF, either NF1, NF2, or schwannomatosis. It's an 8-week live video conferencing program where we teach resiliency skills. We teach ways of approaching the world, hopefully to increase overall quality of life and reduce your stress. I'm currently the clinician for these groups. We also have another wonderful clinician who works very closely with myself and Dr. Franchanu, and we're actively enrolling for this program. We also have an adolescent NF resiliency program, and this is also an 8-week live video conferencing group for adolescents. And so this is particularly for adolescents with NF1 and NF2. And for that, adolescents meet for half the time that the adult groups meet. In part, you know, we try and accommodate a little bit more of the attention time it takes. So the NF adult groups are 90 minutes long. The NF adolescent groups are about 45 minutes long. And these are led by another one of our clinicians who just has an incredible knack and passion for working with adolescents. So the contact person, I'll have the advertisements at the end, of course, and CTF is recording this webinar, so if they need me to send along flyers, I'll be happy to. I think they post them pretty regularly as well. The contact person is Mira Reichman, mreichman@mgh.harvard.edu. Now this other study, this one that we're preparing, is the NF Web project. Now it's kind of a clever name, not so much. It's really just taking the program that we have developed for adults, the Adult Resiliency NF program. We've done interviews with people who've participated in that program. We're in the process of doing some qualitative data analysis so that we can actually adapt this program to an online self-guided version of the Adult NF Resiliency program. We found that despite people really enjoying our program, for those who can participate and who have the availability, really about 1/3 of people who reach out to us aren't able to enroll for one reason or another, whether it be scheduling, appearance concerns, difficulties accessing reliable video connection. That we really wanted to create a program that could address these needs and help people who have that interest in participating but can't for one reason or another. And the effort for this project is exclusively supported through NF Northeast, NF Midwest, and TNFF, the Texas Neurofibromatosis Foundation. Their generous support is making this project possible. We're not actively enrolling for this project right now, but enrollment is pending for the summer because we're currently in the qualitative data analysis phase and adapting the actual intervention, so that we'll hopefully have something up and running by end of summer, early fall. Contact person for this is Paula Popuk, or Popuk, at mgh.harvard.edu. So that's really the webinar, that's my talk. I'm really happy to have had this opportunity. You know, big thanks to the Children's Tumor Foundation. I was so grateful and fortunate to have spoke at their conference this past year in San Francisco. And it doesn't feel like too long ago we were able to attend conferences and be close to this community. And so, you know, CTF provides a wonderful place for people to have resources and connection. And as Pam mentioned, they've been a great support for our group, and we can't thank their contributions. Thank for their contributions enough. This webinar was also supported by AstraZeneca, and so it's important to mention that. And yeah, like I said, these are the contact information. And I assume if you're watching this as a video, you could probably pause on this screen and read these flyers. I'm also happy to provide flyers or get in touch with Mira and Paula to present these flyers. The one on the left is for the adolescent group, and the one on the right is for the adult group. So, yeah, thank you so much.
Great, thank you, Dr. Lester. Since we're still a little bit of time, for folks who are listening in, feel free to type in your questions in the chat, or just let us know that you'd like us to unmute you. We'll be happy to do that too. Or raise your hand with the little hand function that's next to your name. Let's see. So Heather, do you see the question?
Yeah, I do. This is absolutely, Heather, this is a great question. So for anybody who's not on chat, the question is, the NF Web program sounds fabulous. Sorry, I missed this. Will this be research activity only, or available to all patients eventually? You didn't miss the answer. I didn't state this, so thank you. So the initial project is really, we're trying to assess whether, first of all, this is an appropriate and an effective and a feasible program for people, adults in particular, with NF. And so there will be a little bit of trialing of this. So we assume that with a certain amount of revision and refinement and eventual publication of the results, that we would hopefully have a project and product available, hopefully by the end of 2021. In the meantime, we will be enrolling for this project, but the overall and eventual goal is to have this available really for all people who have NF. And so it's an online resource. Part of it also has low human resource that, you know, people will be able to participate without the need for a trained live teacher, because there'll be recordings and audio and video, and having this resource, I think, will be a big help once it's complete. Thank you for the question.
Okay, we'll give it another minute or two. If anyone else has any other questions, please feel free. And I know Dr. Lester will be available to take you can always reach out to him directly, or if you
Absolutely
want to reach through us, we'll certainly be happy to connect you.
I'm typing my email in case anybody didn't get it, but I'm typing my email in the chat area. You're more than welcome to reach out to me. I'm always happy to answer questions, and if I don't know the answer, I'm always happy to find a good source. Just to probe for a moment, if anybody has any questions specifically related to either a few skills to help manage stress, or if they had a couple questions in particular to the first part of the webinar, I'd be happy to answer those as well.
And while people are typing those, I'll just talk about a few other webinars that are coming up. This was wonderful. Thank you, Dr. Lester.
You're very welcome.
You'll, like I said at the beginning, we will take this, caption this, and put it online. Thank you to our partners who've also funded this research, Texas Neurofibromatosis Foundation, NF Northeast, NF Midwest. Thank you, AstraZeneca, for supporting this series. You're going to be seeing other webinars announced in the coming days as well. We've got one on gene therapy, which will take place next week, which we're pretty excited about. You've probably, if you're on our website and mailing list, you've seen our Zoomathon for World NF Day on May 17. And we'll also be announcing a webinar for NF2 Day on May 22. And we'll be sharing all those details. So May's jam-packed of opportunities to certainly be online, but also to come together as a community and learn, whether it's through what we just heard about today or through gene therapy, the more scientific side of gene therapy, and certainly our NF2 community as well. I don't want to just keep talking about promotions for our events, so if anyone has any questions, but if not, then it looks like we may be coming close to an end. So if Ethan, if you want to close us out with anything else, then I guess we'll go from there.
Absolutely. Yes, thank you for the opportunity. I first of all, I think having a little bit of humility here, and knowing that we're all going through something completely new for the first time. You know, it's been compared to other stressors, but there's nothing quite like what we're going through right now. And so giving yourself a little bit of time, a little bit of patience, a little bit of space, or a little bit of closeness, it'll go a long way. Again, we're all figuring this out for the first time. It's also a really important time, I think, for all of us to really reconnect with what matters and what's important. At the end of the day, there are a few things that matter as much as our relationships to other people and how we care for ourselves. And And so giving back to yourself and to others who you care for is an important part of this too. And then the last plug really is, if you're struggling or if you're having a really hard time coping with this, first of all, that's understandable. And second of all, please do reach out and gather support and help that you need, because I mentioned this earlier, but we're all going through this together, and maybe we're experiencing it in different ways, but that doesn't need, there's no need for you to experience this alone. There's people out here like myself and people on my team and others in your community who are very happy to support in any way that we can. So thank you again for having me, and for CTF for valuing this kind of material. I think it's a really important conversation for this community to have resource to manage during this time.
Thank you, Dr. Lester. Those are very, very helpful words and thoughts, and I think certainly, as I said, we'll post this later, and I suspect that a lot of people will probably come back to this and watch it again, especially the exercises that you took everyone through. So thank you for doing this and coming together today, and thank you to everyone who watched, and have a wonderful day and a happy Awareness Month. Thanks, everybody.
Wonderful. Happy Awareness Month. Thank you, everyone.